What does informed consent for Trintellix, otherwise known as vortioxetine, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And one of the medications I've got requested is vortioxetine or Trintellix. So this is an antidepressant. It's FDA approved for depression only, but of course it is used off-label for other indications as well, things like anxiety. It acts a little differently from the other antidepressants in that it is involved in multiple different serotonin receptor activities. So it acts as an agonist at the 5-HT1A receptor and a partial agonist at the 5-HT1B receptor, as well as an antagonist at multiple other receptors. So the potential benefit of this is that maybe it will be better for depression in some individuals since it has a different mechanism of action. It also may have fewer sexual side effects and may potentially be easier to get off of. In addition to helping with mood and anxiety, there's also some evidence that it may enhance cognitive performance as well as improve sleep. The side effects that I'm going to warn patients about are going to be the same as I would for most antidepressants. So that includes things like GI upset, nausea, vomiting, diarrhea, constipation. We are going to recommend taking this with food. Also could cause things like headache, dizziness, fatigue, could cause drowsiness in some, or it could cause activation or insomnia in others. For those who are vulnerable, it could potentially trigger an episode of mania. It could also cause things like drowsiness, itching, sometimes vivid dreams. And although there's less of a risk of sexual side effects, it certainly can still happen. And the same serious adverse effects are things that I'm going to warn about with any antidepressant, things like SI, particularly in the adolescent population through age 25, the risk of hyponatremia, meaning that your sodium levels get too low. There is the potential risk of eye issues, acute angle closure glaucoma in those who have narrow angle glaucoma. There can be an increased risk of bleeding as well as serotonin syndrome, especially when it's utilized in conjunction with other serotonergic agents. As far as tapering off of Trintellix, we are going to recommend still using a hyperbolic taper, even though perhaps it may be easier to get off of than other antidepressants. The safest thing is to take the taper as slowly as the patient needs. And after going through all this, I would answer any questions that the patient might have, and we would move forward making a shared decision from there. If you have an experience with Trintellix, I'd love to hear about in the comments, or if there's another medication that you want to hear me go through the informed consent process for. I'm also putting together an email list for those of you who are interested in my content. So if that's you, then send me a DM with your email and I'll add you to the list. Hope to see you in the next one.